Greetings and welcome. My name is Janice M. Simeon, and I serve as chapter president of the Los Angeles Alumni Chapter of Delta Sigma Theta Sorority Incorporated. I'm honored to welcome you all from near and afar to our first ever 7 days of Delta Care Self-Care Summit. As you continue your journey of wellness and to live a healthy and fulfilling life, we hope that you will take this time to relax, unwind, and enjoy the phenomenal panel of speakers. Thank you for coming to our home. We appreciate you joining us today, and we're looking forward to seeing you in the near future. Thank you again, and blessings to you all. Enjoy.
Good afternoon, visitors, friends, and family. Welcome to the inaugural 7 days of Delta Care Self-Care Summit. My name is Kimba N. Miles, First Vice President of the Los Angeles Alumni Chapter of Delta Sigma Theta Sorority Incorporated. I proudly serve as the liaison to the Mental and Physical Health Committee, who, through this ambitious and innovative summit in partnership with Serenity Sanctuary, are showcasing effective and beneficial health and wellness tools, skills, and platforms that you may use in your journey through self-care. Thank you for joining us today, and may these 7 days be life-affirming and enriching to all. You will now hear from Dr. Gina Davis, Chair of the Physical and Mental Health Committee.
Hello, good afternoon, everyone. This is so exciting. I am so excited to be here with all of you. I am Dr. Gina Davis, and I am the chair of the Physical and Mental Health Committee for Delta Sigma Theta, presenting our first, did you hear me? Our first self-care summit, 7 days of Delta Care. I am so excited. I hope you are too. We're going to have an amazing 7 days with 14 amazing, wonderful speakers. I look forward to it. I hope you are too. And let's just go ahead and get started right now. Our first presenter is Kim Jackson-Mattews and Cori Woolf, presenting with the the Guthrie-Jackson Foundation, Knowing the Signs of Autoimmune Diseases. Let's join in right now.
Kim Jackson-Mattews, a patient of a rare autoimmune disease called neuromyelitis optica, NMO. A member of the Guthrie-Jackson Charitable Foundation's Patient Advocacy Council, and a proud member of Delta Sigma Theta.
We're just having a little bit of technical difficulties, so if we just wait just a moment, we'll be right back at you in just a moment. We're just having a little bit of technical difficulties, so if we just wait just a moment, we'll be right with you in just a few seconds. So hang in there. This is our first time, and we're gonna have a little glitch here and there, which is fine. This happens, but we are getting it together right now. So let's just, we're just gonna wait just a few moments and see what we can get through. Our live stream producer is fixing and doing all she can to get everything fixed. So we're just going to wait just a moment for everyone. Hope everybody is doing well today, this afternoon. I guess they put it on me so that as being chair to just entertain you. I wish I can sing. I wish I can tell a few jokes, but I don't have that kind of talent. But we're gonna be getting started in just a few moments. If everyone can, while we're waiting, if everyone can post into the chat, where are you calling from? Where is everyone calling in from? And what are you excited most about the Self-Care Summit? Yes, and we've got, tell us about your favorite self-care habit, where you're calling from. Yeah, let's hear from some people. And again, we're going to be getting started in just a few moments and see what's going on. Okay, now it looks like that I'm frozen now. Okay.
A proud member of Delta Sigma Theta Sorority Incorporated, Los Angeles Alumni Chapter. In the United States, March marks Multiple Sclerosis MS Awareness Month. But did you know it's also NMO Awareness Month? There are many Multiple Sclerosis MS Awareness Month. But did you know it's also NMO Awareness Month? There are many anti-multiple sclerosis MS Awareness Month. We've narrowed it down to NMO rare diseases, how it differs from MS, other disorders, some signs, our stories, finding a sense of community and resources. Now I'd like to introduce you to Cori Woolf.
Hi, Kim. Thank you for having me today. I am Cori Woolf, Patient Advocacy Coordinator for the Guthrie Jackson Charitable Foundation. I'm so glad to be here to talk to you today about all of these important things and help people understand what NMO really is. First, I just want to share with you a little bit about the foundation. We're kind of this small but mighty foundation out in California, and it was started by Victoria and Bill Guthrie. The Guthrie Jackson Charitable Foundation was established in 2008 when Victoria and Bill Guthrie's teenage daughter was first diagnosed with neuromyelitis optica. It's a life-threatening autoimmune disease, and at the time, in 2008, little was known about this rare orphan disorder. And when there was no existing other foundations or advocacy groups around to help their family, Victoria and Bill dedicated themselves to funding basic and clinical research desperately needed to better understand, treat, and ultimately cure this devastating disease. From the start, they saw the need to venture beyond traditional science models by connecting experts around the world and across multiple disciplines, by incentivizing the sharing of research, vital for life-saving discoveries in the laboratory, and by creating a global community of patients, caregivers, and physicians. The foundation has forged alliances between public and private institutions internationally with academic, industry, and regulatory partners. The foundation is continually helping to spur a groundbreaking global movement on behalf of all of those impacted with NMO. And we know that the work that we're doing in NMO will bring answers to people with other autoimmune diseases like the ones that you described. And I'm so glad to be here talking to you today so we can explain what NMO is, because probably everyone that's listening is saying to themselves, I have never heard of that disease, right? Right. So briefly, I'm going to put up this very boring slide, But it's important to understand what NMO is, because there are several symptoms that we're going to discuss today that may come up in someone else's life, a person that you know, someone that you've met, a story you're listening to at a family gathering, and you might remember some of the things we talk about today and be able to help someone and say, hey, I think I might know what's going on with you. And that is life-changing. Just one person in the room knowing what NMO is or having heard of it can just really change the course of a person's diagnosis. So what is NMOSD? Neuromyelitis optica spectrum disorder, known as NMOSD or NMO, is also known as Devick's disease. It's a chronic disorder of the brain and spinal cord, dominated by inflammation of the optic nerve. And this can, I'm going to go off topic here off of the slide. This is the central nervous system. So when you're thinking about your optic nerves and your spinal cord and your brain, those things are all covered by this myelin sheath. And a doctor once described this to me by saying, if you think of a cord off of your lamp or something, or any electronic device, there's a covering over that, like a rubberized covering. And the myelin sheath on your spinal cord is kind of similar. And this disease, it attacks that covering. So if you think of a cat scratching and tearing away at that covering, and then exposing what's underneath, that's where the damage occurs. We want to protect everything in the central nervous system. That's what our body is made to do. That's why the myelin is there, to protect us. And when that damage occurs, all of the symptoms that we're going to talk about today and more happen. And it's like a misfiring, and we want that to grow back and be protected. So let me continue. It's now recognized that most patients satisfying the current criteria for NMOSD experience repeated attacks separated by periods of remission. This is known as a relapsing remitting disease. And the interval between many attacks might be weeks, months, or many years. In its early stages, NMOSD may be confused with multiple sclerosis. It was once thought to be in actually the same family as MS. NMO was thought to be kind of just a different part of the MS family. And about 15 years ago, it became its own designated disease. And it's very clear, the diagnostic markers, that it is not the same as MS. NMOSD is rare, and it occurs in individuals of all races and age. It is estimated that about roughly 15,000 people in the US have it, though that number is going up the more the diagnostic things that we have now are being used, and doctors recognize and test for this instead of just assuming it's MS. So that number is probably much larger because there are so many people sadly misdiagnosed with MS long before they get the correct diagnosis. The thing about NMOSD is there is a higher rate reported in countries with a higher proportion of individuals of African ancestry, and relative to MS that it mimics, it occurs with greater frequency in individuals of Asian and African descent. But the majority of patients with this illness in Western countries are Caucasian. Individuals of any age can be affected, but typically NMOSD, especially cases of seropositive aquaporin 4 antibody, occur in late middle-aged women. Women are 4 or 5 times more likely to be affected than men by this recurring relapsing NMOSD. And children and young adults may also be affected by this condition. Children more commonly develop brain symptoms at the onset and seem to have a higher frequency of monophasic presentation more than adults. And monophasic just means that they have one major episode and maybe not another one, sometimes never a second one. That my daughter actually has NMO, Kim, which you know, and she was affected at age 15, which is, you know, a rare form of a rare disease. So it sadly can affect anyone. Let me go on from here. And the most important reason why we're here today is to hear about your journey, because all of your details can help other people understand NMO.
Right. Thank you, Cori. And so, yes, we've decided to put a few pictures up here of my journey. Some things definitely are, some things I look at right now. Some people might say, "Ooh, that's, it's hard. It is what it is. It is something that I didn't see coming." And so the beginning of my story starts back in 2020 when I got up one day and I started having eye issues. I was having eye problems with a little blurry vision. And then that was in a few days, it was something that I just didn't expect. I looked up and then I couldn't see. And I went to the doctor, called and I went. And eventually, they were saying they couldn't figure out what was going on because I was somebody at the time really healthy and I didn't have any maladies, meaning nothing like diabetes. And I, at the time, wasn't taking diabetes or any other things. And so I wasn't taking any medication. I was really healthy, an athlete, very active as a personal trainer and all of this stuff. And so they thought, well, maybe it could be degenerative, like, optic neuritis just by age, but nothing really. So at that point, though, they did testing. And then this is fast forward, they did testing, but at that point I had lost vision. I have lost vision in my right eye. And, I said, okay, God, I can live with that. Let me just go on. So fast forward to 2021, where one day, in February, and these are some things too, I'll just have to tell this, in that I did take a COVID vaccine. I had a first one. And a few days later, about 3 days later, I started having some things going on. And we say these are symptoms. And what it was is that I was sitting one day and started at my feet, like neuropathy, and really painful, but the pain escalated where it was more of a sharp electric feeling up in my middle section and also in my back. And, I didn't know what was going on. And I said, this is not normal. This is something that's going on. And told my husband, we've got to go, take me right now to an emergency at that point, the nearest emergency. And where I went, I think at the time, COVID was really the first thing everybody's looking at. Did say my tummy was hurting. I think at that point, maybe, I don't know if it was stress, but my stomach, everything. So and given my age, I'm middleweight, over, 50. And they decided, one, we want to do a COVID test, and that was negative. Two, we want to make sure you're not having a heart attack. And I'm like, I don't think I'm having, I know all the symptoms, but you go right ahead and do those things. And so with that, they ran those things. And then I said, and those were negative and nothing, proven anything else. And the doctor goes, oh, and by the way, yeah, like I said, I had a stomach issue. He goes, oh, go home and like take an enema and call your doctor. And I'm like, but I'm not feeling good. I had this, and I'm not, feeling my feet, or had this weird thing. And I just don't, I'm not feeling, this is feeling something different. But anyway, with all that, I went home, and within another day, barely a day, it was like early the next morning, it just got worse, where I wasn't feeling like I was walking properly, and told my husband, you got to go somewhere else, go to the nearest, my hospital, which happens to be UCLA. And I'm so grateful to the doctors and neurologists at UCLA who, when I first got through the door, I told them the signs and things that I was having. Like I said, the neuropathy of my feet, by the way, had gone from the feet to my legs. It was a numbness in that, and in the middle section, which they call transverse myelitis, which I now have. which gives it's a numbness, but it's also like kind of like a girdle in a way feeling around your middle section. Some people can have it worse than others. And I'm, here to say, thank goodness, it didn't get any worse. Some people say, it's hard sometimes with inflammation. You feel like, a little breathless, but relax. And I know I'm going to be all right. And so, but that was what I have. But some people with NMO have different symptoms, as Cori said. And so, again, what I have now was followed by, the transverse myelitis and neuropathy. That's basically what I live with. And all the pictures are going to tell you when I first got in the hospital where I was to where, walking with a walker, because my balance was a little off. This is all happened. It can happen suddenly. This attack, my first attack. And then, like you see, I had to undergo something called a plex or parapheresis. And if I'm pronouncing it correctly, I'm no doctor. But anyway, I do know what I've had. And they had to, flush out the old, the diseased blood and give you, just like kind of having a transfusion, which I had that too. Then moving on to other things like the treatments. So the treatments of, so that I won't eventually have any more attacks. There's no guarantee, but it is, I have been taking every 6 months called rituximab, which is one of the medications that my doctors decided to use for me. And that right now it seems like it's working for me, along with some other things. So you see, like, my journey, and I want to one day be able to, I do other activities. I want to be able to really get back to those activities. NMO has, right now, it's hard with balance, but I'm doing other things. So, but besides that, I'm going to go back and say real quick that it is important for you to, if people or yourself, don't ignore signs. Don't ignore signs of things that it might be. I know I'm a very active person who was on a computer all the time. So I thought, it was probably at first with the eyesight. It could have been something, a strain of eyes. And that's at first what doctors, but then for me, Cori went through a slide. For me, there are tests, and the other tests are to find out if you have whichever autoimmune disease. But there was a test for NMO that I tested for, that they retested. They done it with the eye, but it didn't come up positive until when I was in the hospital, and that is testing positive for the aquaporin 4. And so, and this is again relative, because everybody who has NMO is not positive with that, and that's something else we may touch on. But it was for me, and so now I have, was official that I had the diagnosis, but it didn't mean that my life has stopped. It hasn't. I'm living a pretty good life despite, and so that's what this is all about, and the road to recovery, or the road to feeling better in between. If I get attacked, it's about continuing on and going up that road, and that's where I am. So, thanks, Cori.
Of course. I think it's important looking at this collage of photos of you to notice that from the time you were first in the hospital through your treatment of plasmapheresis and different stages of recovering from the transverse myelitis, you never looked sick. And this is a really important point with NMO and many other autoimmune diseases. And sadly, it really affects women in the whole journey of becoming taken seriously and being diagnosed.
Mm-hmm.
You just don't look sick. And a lot of the symptoms, I'm going to change the slide here, and we're going to talk some about the symptoms. A lot of these symptoms are very much invisible, very hard to recognize. Clinicians need to listen to the patient. This is a great slide. It's I've borrowed it from the Connor B. Judge Foundation's website. They are another NMO foundation that we work closely with. And, you know, eye pain, that's something that is, you're talking to your doctor, to your clinician, telling them that my eyes are hurting. This is not normal. You went from feeling like maybe it was strain to, you know, it's more than that, but you have to have someone that's going to hear you and listen to you. And the tests are pretty specific. Even with eye pain, you know, someone needs to really do a thorough eye exam, and sometimes an MRI of the optic nerves in order to find this, the lesions that can develop, like I talked about with the cat scratching. That can come up on an MRI. People have that done with contrast. And usually that needs to be ordered by a neurologist or a neuro-ophthalmologist, which is a very specialized doctor, not always in the ER. So sometimes it takes a few trips to the emergency room before a lot of these other things are really taken seriously. I'm just going to go around these symptoms and we could just talk about it together. So fatigue, nausea, vomiting, those again, you know, well, fatigue is obviously something you can't see, and nausea and vomiting is pretty common, right? We're living in a time of COVID. That's a COVID symptom. It's a flu symptom. But when it doesn't go away, that is when something, you know, that voice in your mind has to say, something is wrong here. I should not be vomiting for a month straight, especially if you know you don't have COVID and you know you don't have the flu, right? I'm not sure if you had that symptom that persisted. My daughter had a relapse once with, it's called intractable vomiting. It just won't stop until you get treatment for it, which is awful. But at the beginning, they thought she had the flu. The limb and trunk pain and sexual dysfunction, these are all parts in that group of things where you can have numbness or a tingling sensation, sometimes a squeezing sensation. People describe it as a very strange hug. It's a tight, yes. And sometimes you don't even know that was a symptom until you talk to someone else that says that, and you're like, I had that, right? There's some kind of comfort and validation that comes when you talk to another patient that has had the exact same symptom as you too. But those things, again, are very hard to measure in a clinical setting. Vision impairment is, you know, part of what you're describing to your clinician. They can do some testing. Weakness, they can do some testing. But sometimes people with the beginning stages of transverse myelitis may not really show a lot of weakness in a clinical setting, but they feel it. Bladder and bowel issues, same, you might be feeling like you're still able to control those things, but it doesn't feel normal. That's a big sign. If you have those symptoms, definitely call your neurologist or at least get in with your primary care physician. And spasticity can cause like cramping and pain. More abnormal than, say, if you just got a cramp in your calf overnight from being maybe a little dehydrated. This is something that you would notice is just definitely not normal. And most people say that I have talked to a lot of patients that it is extremely painful. Have you had that as well?
Yes, you know, I'm going through, failed to say that earlier, but yes, I experienced, spasms, and mine come in the same area, unfortunately, as the transverse myelitis. So it's like right under, sometimes under my heart, it's like, oh, it'll stop me. But, and I'm taking some medication that's trying to help with that. But also I do other things, too, like yoga and, relaxing and stretching and physical therapy. All of those things have helped me, thank goodness, because right? Yeah, because I don't necessarily want to rely on the medication for me, but if it's going to help me feel better, then I'm doing it right now for the moment.
That's wonderful. As we're talking about that, about self-care overall, which is
Yeah.
what we're discussing, a lot of the symptoms are really something that have to be managed, because this is, not a cured, we don't have a cure for NMO. It is managed with medications. As you mentioned earlier, there are some good choices of medications for preventatives that prevent continual attacks in most patients. The one that you mentioned, rituximab, there's 3 approved therapies that the foundation helped to fund research for. They're very proud that there's things on the shelf for people to try. But there are still symptoms that linger, and really taking care of yourself and really recognizing what works for you is so important. And that can be everything that you mentioned: physical therapy, occupational therapy. Some people see acupuncturists. Some people, do yoga and continue to work out, at any range of exercise. Moving is so important. I know Victoria Jackson is a big proponent of meditation and self-care as well. So really seeking out anything that is of value to you personally is so important. One thing that's most important, especially during COVID, because you have really been through this, Kim. I mean, to be diagnosed with NMO in general is hard enough, but to be diagnosed with NMO during COVID, I think it's even harder. It's been so isolating already to everyone, but it's a different experience when you're at the hospital alone.
Oh, yes.
I mean, I know when I
first that for a minute. Yes. Yeah, we did. And how we didn't talk about that part, but yes. And I just, thank God for the technology, but I was there by myself going through some very, we won't get down, but some very hard things that I had to do, procedures that I had to do. And luckily, I had my husband with who I could get on the phone. So I said about technology and do FaceTime and those type of things to get through. And then also my meditation or prayer helped me, because I was lucky to have a friend who is a pastor who happened to be, UCLA was one of his rounds. And I was like, oh my goodness, thank you. He came in.
What a blessing.
He was the only one that was able to come in and see me, that was approved, that I knew outside of a doctor. And I'm like, oh, that helped me so much. And and so I that helped me to woo-saw and get through. Yeah. So, and playing my music, that's what the doctors remembered me by, I was playing music loud, and they're like, who is this? But anyway, we all have our ways of, getting through, and I still do that when I'm feeling, a little pain, to say, put up my Christian music and keep going.
Right. Well, that just brings us to talk about the value of community and how important it is. When you were so isolated, you still at least one person to come and pray with you, right? Or to feel like you were in a room full of people singing with music loud. You can close your eyes and put yourself, with other people.
Right.
But finding others that you can share stories with and be with, it's so important. And I know that that's really like a lesson for everyone during COVID. But there's a different kind of isolation that comes when you have a rare disease. And that doesn't mean just NMO, that's any rare disease. It can be very isolating.
Mm-hmm.
I know. Oh, go ahead.
For sure. No, for sure. Go right ahead. I was just saying it can be very isolating. So one of the things you have, we decided to put some pictures up, but that I was fortunate to find in my research. I was in the hospital bed, and yes, I used I think I Googled, I ended up having my laptop with me, trying to do some work, and with the sorority at the time. And I'm like, wait a minute, let me, Google, because I'm going to go down with a fight if I'm going down. And I said, I have to do a little research in it. And it put me, and I'll say this everywhere, my fingers Googled one day the Guthrie Jackson Charitable Foundation here in my state of California. And they happen to be like Beverly Hills, Los Angeles. And I'm like, wait a minute, what is this? Just a wealth of information. And I was able to find the phone number, and this is how I met wonderful Cori on the phone, who called me back, and we talked, and she was just so warm and listening about my story, because I had no idea what this was, what I was going to do, what resources, and am I, maybe, I know UCLA was right, but I needed to be connected with people like me, and that's what I saw, who patients on the website, what they did and how they connected us, and all the things that they're doing, the wonderful things, from walks to groups to, advocacy, and on and on. And so it's helped me a lot come out of, feeling that isolation, not let alone feeling isolated with, the time period of being in COVID. But all of a sudden, my friends knowing me, my friends in circles, being the upbeat person, to now I have this disorder or disease, and not feeling like it's contagious, and able to say, hey, but I think you need to know about it. Is not. And I though you may ask about it, I wanted to tell you in this way. But the main thing, so like I said, Cori, is me meeting you has really done something for, me, and knowing I value the value of community is important to people, having a positive circle around them to get through having a rare or any autoimmune disease, right? For whatever it is. And all those smiling and encouraging faces that I see even on this screen, I want other people, if you're have an autoimmune disease and you're on today, to definitely, reach out. Don't be afraid to reach out to people.
Absolutely. And it's just as valuable to us that you've joined our community, and we're sorry that you have this diagnosis. We don't want people to be diagnosed with NMO, but when you do come together, it just lifts everyone up, and you've been a great addition to that. And I'm so glad to know you.
Thank you.
Of course. So in discussing a little bit just about advocacy in general, I have this great quote. I love this quote. I'm just going to read it. I learned a long time ago, the wisest thing I can do is be on my own side, be an advocate for myself and others like me. And that is so powerful, because what you learn in any trial that you face in life is that you really have to learn to self-advocate. You have to, sometimes, and in your case, you were really by yourself, especially at the hospital, right? You had to be your own voice. But then afterwards, there's this strength that comes from going through that. And I feel it's an obligation for me, having gone through this with my daughter, to advocate now for others that are going through this as well. Because I was in that place where I was afraid, I didn't understand, I was researching, trying to find anything I could. And the most valuable thing was when I found other people that really understood what was happening, and they helped advocate for me and my daughter. And now I'm doing that to hopefully help other people in the same way that I was helped at the beginning of this journey for our family.
Awesome.
And I know that you're doing this too. You're on this road to advocacy too, Kim.
Yeah, it's been incredible, with the advocacy, and just being exposed to so much, and being able to have that voice, and be that voice for people who, can't right now, or who are ill right now. And I said, to you, as long as I have a voice, I'm going to use it. I'm going to use it for everything. And not just this, with the Guthrie. I'm also, I believe it's still up, neurologylive.com. I was fortunate through Guthrie Jackson Charitable Foundation to be hooked with that, with the patient advocate, being a patient advocate. So we're on and speaking on their site. So.
That is great. We'll have to link that in the chat for people to be able to find that. We'll do that. I just changed the slide to show a couple of things that the Guthrie Jackson charitable foundation is doing for patients, programs that we run. We do have several things that we try to do for just improvement of quality of life, to lift our patients up. Advocacy work is very personal on some days, one-on-one, like you and I meeting over the phone and over Zoom and talking. But other times it's group things and programs that we put together with the sponsorship of our industry partners. And last year we started a program called Artistry in Motion, and it was born out of that isolation of COVID. We used to get together, our support groups would get together in person. And those, of course, couldn't meet. People couldn't meet in person. We have a lot of obviously immune compromised people that are even more afraid to go out than the regular public, which is, has already been wearing masks and socially distancing for a long time. But we put together this program so that we could bring patients to do an activity together, talk, but also we brought in art therapists to run the program. So it's not a process of art where you have a product at the end. It's the process of art where you're really tuning in. It's self-care 100%. And I know that you've gone to a couple of the workshops. I too have attended the workshops and enjoyed them very much. And we just started a new series for 2022. There's going to be 24 workshops this year. We're very excited for that to take off. You're going to have to share your art one of these times on one of these kind of
yes. Yeah, I will.
Yeah.
It was so much fun.
I'm glad. Did you enjoy it? I mean, did you feel relaxed afterwards? Because I did.
Yeah, the most recent one that we did this past Sunday. Yeah, it was and in this one, the art, but the other one, yeah, we did recently. It just makes you relax. They talk through everything about how to, get rid of everything like that you're thinking, like, about your disease and stuff, and just be in the moment. Be in the moment while you're doing everything, So I first start out, breathing and definitely, take in everything. And that's what I like. I love the instructors. And it isn't necessarily about like the art or the scrapbooking or whatever it is, but about you, where you are in your space, in your place.
That's great.
Mm-hmm.
And then just the sense of community, we're trying to get people to be able to be back together. We were hoping in March that we were having our a regular patient day, but it is turning to virtual now because of Omicron. So on March 13th, the foundation is hosting a virtual patient day. It is open to the public. It'll be on Facebook Live. It's super informative, whether you have NMO or not. There's going to be great speakers there. And it's just a really informative few hours that morning. And then we just announced today, actually, that there will be an in-person event later in July. So we're excited about that. Bringing patients together is always so important. But a lot of the work that we do at the foundation in the advocacy team is really connect patients with resources that can help them very specifically. And there are advocacy groups across the board for lots of different rare diseases. And that's really important. I know we're talking about NMO today, but rare disease, one person has a rare disease, but there are so many people that have a rare disease. It's a pretty large community. Not all the same, right? But it's a pretty large community. So we try to direct people to different foundations that offer help that we can't offer. And one of those is the Assistance Fund. This is an amazing foundation. They have sponsorship programs for over 70 rare diseases. I would encourage anyone watching this to go to their site, tafcares.org. The people that run this, they run this from their heart. I've met with several of the people, amazing people really out there helping patients and families that are financially in a very tough place, because rare disease can devastate a family's finances pretty fast. I know I have lived through that when a child or a member of your family, patriarch of the family, is right, is in the hospital for months or weeks. It doesn't matter. You have loss of income, you have, it just changes the trajectory of your family's year or longer. So the Assistance Fund offers all kinds of help, from co-pays to extra things. Amazing foundation. I would highly recommend looking them up. Another one that we direct patients to is called patientadvocate.org. They also have similar programs. You can go in and it's a really easy site to navigate. You can find the disease that you're trying to understand better. They do a great job of helping people anywhere at every level. And I highly encourage people to go and look them up as well. And then there is a foundation called NORD. A lot of people have already heard of NORD that have not even really been in the rare disease space much. They have a far reach, and they do a lot of fundraising too. This is a great foundation. They offer lots of different ways to help patients. So you can look them up at rarediseases.org. There are things for clinicians, researchers, patients, families. There's ways that you can go in and find a way that you can help if you don't have a rare disease, but you want to get involved. It's a great place. You can navigate their site very easily. They do lots of events through the year. February was just Rare Disease Month, and there was lots of events for Rare Disease Day, which is always the last day of February. And that just is a great way for us to start, March being NMO Awareness Month. It kind of gets the momentum going. Last year, the Guthrie-Jackson Charitable Foundation started the Patient Advocacy Council. And you'll see this beautiful woman in the center of that photo in a red dress. And that's Kim, and she joined the council. I'm so grateful that she did. We have a great team of patients and caregivers that are now helping other patients and caregivers in their more regional areas. So it just helps to grow the patient advocacy work that we're already doing at the foundation by having lots of people all over the country, and soon it will be international, to help patients everywhere. Are you enjoying being on the council, Kim?
Oh, yes, for sure. This is, like I told everybody earlier, as far as making that connection, this has been great because I really am able to talk to other people like me that are, and also in their families. You see pictures there, but caregivers and their experiences, and also that just has helped me and my family, my husband, seeing that we're not alone, and there are other men with it. There are men and their wives, or the reverse, that helping women that are helping their spouse, and it's been very powerful, very, very helpful, and for me, not just to be that advocate in the council, but also some recent things, getting and helping someone. So finally, over the last couple of months, I've been able to, I got patient calls or emails from patients asking some questions, and I've got that relationship with the patient, and that's really something that's helped me help them, and it's definitely helping me to do the outreach, to give resources to, and also telling through my story or my experience has helped out a lot.
Yeah, that's wonderful. Well, any patient that calls is lucky to talk to you, because you have such a great sense of empathy and compassion, and we're just so glad to have you on the council. We call it PAC for short, and it's been very good. We're excited for it to grow. Thank you so much for having me and for letting me talk about the foundation. I want to close with your vignette. So we have this program through the foundation that we share on social media. It's called NMO Stories, Hear My Voice. And it's a collection of stories from patients and caregivers. They're usually a couple minutes long. You can find these on our website. Sharing a story is so validating for patients and caregivers. It's a moment where you can tell your story and people listen and they really can learn a lot. So I love this program. You can talk for so much longer than 3 minutes about what's happened to you, but when you have to put it down to a small amount of time, it's just a powerful way to tell a story. And I think you've done a beautiful job. So I'm going to share that.
I always thought of myself as fierce, unstoppable, and strong until I got the rude awakening in February 2021 when I had a severe attack throughout my body that would later be diagnosed as NMOSD and transverse myelitis. Thank you to the neurology team at UCLA Ronald Reagan Hospital who recognized the signs. The neuropathic pain started at my feet and traveled like an electric shock to my midsection and back. I am living with pain every day, and somehow that fierce, unstoppable, strong mantra I once had has been challenged. Oh, did I mention I lost eyesight in one eye in August of 2020, leaving doctors baffled as to why, because I was healthy and an athlete. I was told the disorder was rare. So while in the hospital, I quickly did some research because I felt that if I was going to fight this thing, I'd better start now, knowing all I could about it. My search landed me on the website of the Guthrie Jackson Charitable Foundation. I learned of Victoria Jackson and her husband, Bill Guthrie, and their amazing work towards funding research and helping find a cure because of their daughter, Allie, who was diagnosed. One phone call to the organization connected me with an amazing director, Cori Woolf, who listened patiently to my story. That gave me hope. She invited me to join a Facebook group of people going through the same thing. I did, and am now a member of the NMO Patient Advocacy Council. My name is Kim Jackson-Mattews, and I am fierce.
Thank you. Thank you very much, Cori. And I think this was great today, what we were able to share, even for this moment. And any questions we will answer. Anything we will be able to, any others we will put in the chat, and we will deal with at another time, and or give information to everyone.
Yep. And people can reach out.
There we go. We have some questions that we are about to put up that I see have come in. And I want to just say again, thank you so much for the platform today. We did have to narrow it down and talking about autoimmune diseases and definitely share with you from my perspective. So I really appreciate that. I just want to talk about, well, there was a question that came in and I'm going to go over it. I see it there and it says, how is self-care important to an autoimmune disease? Thank you for sharing that question. As we said, so many things have been answered probably in this time period, but I'm just going to reiterate because our whole summit is about self-care. So I would answer it like this. It is important to improving our health and facing it head on. It's like even in diversity, even when you don't feel good, you just have to keep going. So I suggest you eating healthy with the most nutrient dense food you can buy. Find 15 minutes for yourself, go for a walk or just get outdoors and breathe, right? And lastly, unplug from negativity like TV or anything that brings upon a stress level, because that isn't good for any autoimmune disease. It could cause you to have a flare. Okay, so the next one, Cori, you want to take the next question that I see coming? There's a next question coming in.
Yes, there's a follow-up question to the one that you just had about what is the best way for a caregiver or spouse to practice their own self-care. And building on everything that you just said, which really can be used for anyone in this situation, for caregivers that I speak to often and that I know and I live this, it is so important that we take time, find time that is our own, find time for yourself. Because, you know, it's not cliche to say that if you don't take care of yourself, it's really impossible to take care of someone else. So, finding time that's yours alone, getting up first, maybe before the person that you care for, having that first cup of coffee in the morning alone by yourself, journaling, and finding time to exercise. Maybe something that the person you care for can't do, that you can go do a short time by yourself and then come back. You'll just feel better in your journey of caretaking. Another big thing is sleep. And I need to remind myself of this all the time. And I remind people I speak to all the time. Resting is when we heal and we rejuvenate for the next day of this work. So you have to sleep. And then connecting to other people. We talked about the importance of community in the presentation. And that's just as important for caregivers as it is for patients. So places like NORD that we brought up, they have lots of connections. The Guthrie Jackson Foundation, we support different support groups that are run through Facebook usually. And there's a specific caregivers group. No patients are allowed. It's all caregivers. It's a wonderful group. Everyone can bring their own thoughts to that. And I would encourage people to find support groups like that, connect to other caregivers, and even just with a family member or friend, one-on-one, not a text, in person, or at least a FaceTime. It can make just a complete difference in your week if you connect with even just one person for a short period of time. Do we have any other questions, Kim?
No, I think that's all we have time for today. And I thank you again, Cori. I just want to make sure that we put in the chat our emails so that people can connect with us after. So you'll see those in the chat as well, both our emails. And then also we're adding to that, there are different websites that we were talking about. There is neurologylive.com. You will see all that in the chat. And I think that was it. So everything else was in the chat. And I just want to, again, because some of you who are coming on or came on late in the beginning, there might have been a little glitch to the start, but just saying thank you again. I'm Kim Jackson-Mattews, and one thing that I'm so happy to be a part of is not only that I'm a patient with an autoimmune disease, but I want to thank the Los Angeles Alumni chapter, my chapter of Delta Sigma Theta Sorority Incorporated, for giving me this platform, and to know that I am one of the co-chairs of physical and mental health. Thank you, and that's it for today.
Thank you, Kim.